Do you have pain at the back of your heel while wearing a shoe? This could be a pump bump or a Haglund's deformity. This is pain on the back of your heel, and we're going to show you how to fix it at home safely and skip the surgery. And we're starting right now. A Haglund bump could be a few things. It's usually a big buildup of the heel. So when you're walking, it's rubbing against the back of the heel. This could be in high heels. It could be in shoes. It could be retrocalcaneal bursitis. So this could be soft tissue swelling at the back of your heel. That's a very common cause. So it could be your Achilles tendon insertion. It could be the bone. It could be the soft tissue. All three are very common. Even number 4, a heel spur. So all of these can cause back of the heel pain, but don't worry. This treatment guide will help you take care of all 4 of those problems. So we've got you covered for all. This specific video is about the thick bone back here. So this is sometimes known as a pump bump because it can irritate you in high heeled shoes, but it's not quite a spur. It's for people that actually have a big bone that's prominent and rubs. For most people, it's not just the bone, it's the actual twisting. So when you walk and your foot turns out, that heel twists and rubs on the outside and the back of your shoe. This is what bothers the back of your heel. This then causes the tissue to swell in the back. It causes your Achilles tendon to hurt in the back. All of these contribute to each other. So the 4 problems are all related for sure. And a Haglund bump is one of the most popular causes. Risk factors are a tight Achilles tendon, a tight shoe, a rigid heel, skates, for example, roller skates, ice skates, everything. All of these can antagonize it. Running shoes are generally softer, but cleats, football cleats, soccer cleats, all these things cause back of the heel pain. So specifically, it's pain in the back of the heel. It's where it rubs, and it's usually one foot worse than the other. Although both feet could definitely be hurting. It's usually one foot that's the worst one. So the best diagnosis is you got to get to your podiatrist. What we do, that's me. I'm a biased individual. Hey, it's my video. I'm doing it. But what we do is, number 1, you can feel it. You do a physical examination, then we take x-rays. On x-ray, you're going to see a prominent heel bone. You're going to see a spur. You're going to see a tight, swollen Achilles tendon, usually in these cases. And you want to diagnose it because if it's a rupture, if it's a bone tumor, if it's something unusual like a broken heel or a stress fracture in your heel, this is terrible news. You don't want to live with this because this could be dangerous. And very frequently we see problems that people struggle with for years that could have been easily corrected. So here's how you want to start treatment. Number 1, I'm a big fan of stretching out the shoe. And here's how you do that. This is a great heel stretching device. So this is like $15 online. That's why I include it. These seemed ridiculous to me, but look at, you can put some pegs on there for 5th toe joint pain, bunion pain, hammer toe pain. So you set these up and basically you can stretch out that front. So you can see it correlates to those areas. And when you put it in the shoe, it can stretch out the front of your shoe and your heel. So this is a multi-use device, but we're mostly interested in the heel. So let's get it in there and see you have that back stopper. So by twisting it up front, it'll stretch out the front for you. So a lot of people that have heel pain might need this as well. But as we're getting the pressure off those areas, let's take a look at the heel. You stick it on there and you extend the heel. So you can see for your bump in the back that stretches it out. And it can stretch out the top right there. So great multi-purpose tool. And what you want to buy is a shoe spray. This is like $5. You know, I think this one was like $7 online. But it's great for all types of shoes. And what that does right there is you spray it on there. It takes 24 hours to solidify. So you can see I plug it in there. I just spray it on there. I'm not doing it in this demo, but you get that on that heel and your heel is less likely to rub. This can work on almost all shoe materials, but be safe. Don't ruin your shoe by going too crazy. You want good shoes. So a shoe that's pretty firm. So it should only really bend in the toe, but a firmer shoe. If you can take your shoe and bend it into a V, that's not a good supportive shoe. And this is for slippers as well at home. You want something supportive at home and something outside the home. guess what? We have our best linked shoes and slippers right down in the show notes. Check them out. They're the best stuff online. They're definitely going to help you. And then you want to get an insert. So a couple things right here that the insert does is, number one, your heel sits a little bit higher, so it gives you a little bit of a lift. For heel spur and Achilles tendonitis, sometimes just lifting it a couple millimeters makes all the difference. And number two, here's what it does. Remember how I showed you the back of the heel twisting? When you walk, your foot twists. So what's happening is the back of your heel is rubbing and twisting on the back. But watch this. Boom. In an orthotic, not only is it lifted, but it's not twisting. So see this right here? When I push down, it's not twisting. It just moves straight up and down like this. No heel twist. That's the real beauty of the orthotic with this condition. Physical therapy, just like stretching at home, works great. I always send people a physical therapist. Get your hips, your hamstrings, your calf muscles checked out. Stretch all these muscles out. It will help you walk much more easily. So as you ice and as you take anti-inflammatories, all that pain will decrease. In surgery, heel spur surgery, Haglund bump surgery, it can work well. So essentially what happens is there's a way to shave down the heel bone. The problem is your Achilles tendon attaches here. So you have to detach the Achilles tendon. You have to shave the bone with a bone saw, and then you have to put that back. Do these work great? They work great. So if you have a huge heel spur, it works really well. Here's the big problem. You're in a cast for me, it's 6 weeks. Then you're in a walking boot for 6 more weeks. And we generally have to lengthen your Achilles tendon at the same time. If you can do this by stretching, I highly recommend doing that ahead of time. If the heel's sore, medication can help. So this is your anti-inflammatories. Tylenol, for example, will make your pain sensation decrease, but it doesn't really decrease the swelling. Things like Aleve, ibuprofen, anti-inflammatory, non-steroidal, anti-inflammatory drugs definitely help. The problem with this is your swelling goes down and you keep walking and your heel just keeps rubbing. It's not really fixing your problem. We want a better solution. One of them was stretching the bone, but we want better solutions. Another great solution is you can massage out the heel. So in the morning, stretching, massaging gently, you never want it to cause pain. That can really help. But just like the anti-inflammatory medications, the swelling goes down and then you just start doing the same thing all over again. The real key is you got to stretch out the Achilles tendon. You have to lower your heel height. Otherwise, you're going to keep having the same problem. This is the real solution.
This is how you start a good stretching program. So number one, you just want to warm up your feet, especially if you have heel pain, plantar fasciitis, Achilles tendonitis, and then a massage roller stick, $7 down in the show notes, but just gently massage your calf muscles, your Achilles tendon, your anterior muscle group. So this is for the front of your foot, your plantar fascia. You want to relax that. And then for your hips, so for your glutes, your hamstrings, you can put your body weight onto the massage roller. Just get all those lumps, all that swollen fluid out of there. Studies show this gives you a few hours of severely increased flexibility. And then these little spiky balls, if you ever see this, that's for putting your body weight on to massage your plantar fascia out. It should never be painful, but just get that swelling out of there. So look at, before this, I could probably barely touch my toes. But now every muscle's warmed up, massaged, and now we're stretching with a towel. And you can see with the towel, I was turning my feet inward, and now you can stretch your plantar fascia. See that? Right there from the bottom of your heel to the front of your foot. So stretch both feet at the same time. I create a lift for your feet. So you're getting that extra bend and keeping your feet straight, and you're getting that extra angle through your ankles because that's the key. And then you want to stretch your groin muscles. So your inner hamstrings, your posterior hamstrings, your glutes, just warm those up 30 seconds per muscle group. This thing is for sale for like $10 to $14 online. But what happens is it hurts the back of my heel, especially with a Haglund bump. So I love these blocks. This is called an ankle incline block right here. You want to set it on the low settings, and we're talking like maybe 20, 30 seconds to a minute, and gradually work your way up. It should never hurt. See, at this angle, barefoot, you're slipping as I go through the settings. So you want to start on the low setting and just make sure the back of your heel's not hurting. That stops your heel from twisting out, and that will help your Haglund bump. And on this guy, this is a hamstring stretching device. This is only for people that feel they need it. But see, it holds your foot turned up while you stretch your hamstring. And at the same time, while you're watching TV, you can lean back and lean your body weight into it. Just like this, I'm going to show you again. But realistically, why not just use gravity like I did in the earlier steps? Just use your body weight to lean down and stretch your back and your hamstring at that point. At the same time, get an orthotic into your shoe because you want your foot turned in. If your ankle's just twisting out, that's just a motion called subtalar joint pronation. It's more comfortable in the shoe, plus your orthotic holds you in the proper position. You're getting more of a deep stretch through your calf muscle and your calf flexor tendons. So same kind of thing here. With the ankle incline board, you want to wear the shoe and gradually work your way up. It's more comfortable. You're less sore in the prominent areas in the bottom of your foot, and work your way through these. I recommend the ankle incline board the most. It's the best one.